Mina Aisatus Maisise. As the Ministry of Health and Sanitation continue for the status update about the COVID-19 in the country, Sarah Network at the National Emergency Operations Center concerning the update. Make we listen to the official chairperson for the COVID-19 response team, Solomon Jamiru, as they give the update and also respond to some questions.
Good morning, everybody. Welcome to today's press briefing for the 30th of April 2020. We'll go straight away with the status update by the official spokesperson. We have some subject matter experts here this morning. We have Colonel Aidara Bangura, and others will be joining us shortly. Okay.
Thank you, Harold. I crave the indulgence of us and even those of you watching us and connected all over the world, wherever you are, that in honor of the dead, we do rise and observe a moment of silence. And that as we all do rise, we also bear in our hearts and in our prayers our healthcare workers, our psychosocial workers, and all families going through a moment of grief. And for our country, Sierra Leone, may their souls rest in perfect peace, and God bless us all. So status update for 30th April 2020. Total cumulative confirmed positive cases, 124, 124. Total number of deaths, 7. Active new cases, 8. Active cases at isolation centers, 96. Cumulative recoveries, 21. Number currently in quarantine, 1,166. Number discharged from quarantine, 1,448. Harold.
Thank you very much for the update. We will straight away go on to questions. And if you want to ask a question, you say your name and your media house. Okay. We'll take rounds of 5 questions and then we'll do the responses. Yes, any question? Yes, your name? Okay. Please, can you mute your mics? Okay.
Those 3 deaths, are they from the treatment center? That's one there, the new cases. Tell us about the new cases.
Okay, noted. Yes, any other questions? Any more questions?
Whilst we're waiting, you may wish to just handle this first one.
Yeah, okay. Yes, yeah.
The increase of the cases, they have more equipment to fight the coronavirus, because we are seeing yesterday 160, today is 120. Do we have the equipment to fight the coronavirus?
120
it's
today?
124.
Yeah, yeah.
124.
Okay.
For the deaths, the new deaths we have 23. We have a death from Kenema. This is a 23-year-old who had exhibited signs of COVID. In addition, the person has, has a protracted illness for about 2 years. So it might be what we call comorbidity. And the person was tested and it was positive for COVID. So that's the case for Kenema. And please mute your mics. And the next one is a pregnant woman from the Princess Christian Maternity Hospital, that is PCMH, who also showed signs of COVID. She was tested and positive and later died. The third one is a death from the treatment center, a 71-year-old who was being treated at the isolation facility, and he was in intensive care at the isolation facility and later passed away. So these are the 3 deaths that we have. And for the new cases, we have, for these cases are coming. Please put your mics on mute.
Bond is 6.
Yes, yes. Okay. For Bond, we have 6 additional cases added to the previous 4. And then we have 10. So they are coming from those areas. Okay.
Tonkolili was 2. We have an additional 1 for Tonkolili. Kenema was 3. We have an additional 1 for Kenema. That's the statistics for now. With us also this morning is Colonel Aidara Bangura, who is the lead for the operations pillar, and he's been very instrumental at respective stages, and he continues to do so. So should there be any question relating to his pillar, he would be very much pleased to respond to those questions. Any further questions, please?
Yes, sir. One would still have concern about the case to Bond. It's tight insecurity. How we have case to Bond? Bond is a fine because the water the city reach to Bond. So how did we have a case in Bond?
Okay. When we say Bond, we mean the Bond district. It's not the island. We have the mainland. Okay. Mainland Bond. Okay.
Probably to make an addendum to his question, we probably want to know whether the cases in Bond have any link to previous cases.
Yes. The cases in Bond are appealing to a case who visited the district and ended up in Tonkolili district. So the first case in Tonkolili district was appealing to Bond district. And these cases are coming out as secondary, transmission from that second generation transmission.
Please go ahead.
Yeah.
So from social media, we have a question from Steph Marion. He said, today, CISFEP reports 29 healthcare workers have tested positive, 27 from non-COVID facilities. What messages do we have for people exhibiting symptoms to prevent them going to health facilities? And what can people do to protect healthcare workers and patients?
Okay.
Yes.
Yes.
Okay, so from Pulse Africa, we have someone from Mohammed Ba says, good morning. Please ask if there is a consultation with other African countries like Senegal, and their treatment as they are using, and also possibility of getting some kits from them.
Are there any questions from our friends in the virtual world?
Yeah.
Yes. Okay.
Yes. I would like to know how effective is the social mobilization pillar at the moment at community level. How are you collaborating with community leaders, for example, in ensuring that people work towards the safety measures of the virus? Because for now, at some communities, people don't put on the masks. People don't actually work towards some of the measures that the health workers are saying they have to adhere to.
Okay. So can we start the response?
I think the one from Precious is indeed an important one. There are always, Sierra Leone has bilateral relationships with countries all over the world. And so within the context of our bilateral relations and multilateral relations, Sierra Leone continues to be in touch with countries all over the world, and sometimes not only requesting for support with respect to equipment or personnel, but also with respect to countries sharing with us their best practices, some of the things that they may have learned in the course of COVID-19. And we are having nations reaching out to us and sharing those best practices as much the same way as Sierra Leone continues to share its own emerging best practices, first for Ebola and also with COVID-19. There are countries who would say to us that the initial closure of the international airport was a step in the right direction. There are universities who will always reach out to us and send research persons, and they would always pitch the examples during our Ebola as one of the best that that countries should emulate. With respect to Senegal, of course, Sierra Leone has very close relations with Senegal, and we continue to be in consultations with not only those West African countries, but countries all over the world, because it is important. COVID-19, as it has come, has created an exponential rise in figures, quite different from what may have happened in the course of Ebola. We know that the pandemic is global in scale. This has not happened in the 75 years history of the United Nations. And the last time something of this magnitude happened was about 100 years ago. So there are countries that may have done well in terms of building up their health capacity, but today they seem to have been very overwhelmed by this. So not only with respect to supporting ourselves with equipment, supporting ourselves with personnel, but I think the cross-pollination of ideas is something that Sierra Leone continues to engage with, and Senegal is not an exception. Somebody asked about healthcare workers, protection for our healthcare workers. Perhaps I may speak to this in part and see how Harold may come in and complement. It's very important. So that is why government, after several engagements with the healthcare workers, decided to give incentives. And I'm sure those incentives have been announced, and the media is privy to what government has done to symbolize government's demonstration that we will continue to support our healthcare workers, our 4-tier healthcare workforce system, the doctors, the pharmacists, the nurses, and the community health officers. And we're also concerned that some of the critical equipment may not be in abundant supply, even the PPEs for our nurses. I was at Gloucester the other day, and the headman was drawing my attention to the Gloucester Community Health Post, that it is important that we scale up on supply of PPEs for our nurses and other critical healthcare workers. So whilst we can say yes, at this point, we may seem to be fairly comfortable with respect to what we have, but I think that there is a lot more that we have to do with respect to getting the necessary resources to fight COVID-19. And we want to assure our healthcare workers that they will continue to enjoy the support of government within the limited capacity that we have, even as we continue to reach out to our partners to complement us. Harold?
Yes, thank you very much. And with respect to our health workers, that is why at this stage all health workers are practicing what we call universal precautions. Whether you are in a COVID isolation center or in a normal health facility, the IPC, infection prevention control, is paramount, and also universal precautions. And also there are temporary isolation facilities in all major health facilities. That is why when there is a suspected COVID case, that person is put in an temporary isolation facility, so that it does not jeopardize the safety of our health workers or other patients and clients. And for Senegal, we are in collaboration because we have a network across West Africa, about 16 countries. And we cannot get kits from Senegal because we are getting the kits from the same source. But because also for laboratory, they have what we call the Institute Pasteur, one of the Pasteur Institute, and then sometimes we do what we call controls, from those laboratories. But we have very good collaboration with Senegal, and we share the lessons identified across so that we'll be able to use best practices and evidence-based to continue what we are doing to prevent to prevent all of us from COVID-19. Yes, Yema, you have some questions from the Facebook page. Can you?
So I have comments and questions. So the first is a commendation from Vicky Remo. She says, I would like to commend you for changes made to improve sound and picture and for getting the health message of well done AUC. From Patrick Levy, he says, with the high figures from Western Urban, is there a possibility of a localized lockdown for most of the affected areas? From Michael Jones, he's saying that from the look of things, there's a clear demonstration of community transmission. What robust measures are being put in place to combat the transmission? And from Steph Malion, what should the public do if they feel sick with known COVID symptoms? Cough, fever, tiredness. Is this only the 117 line? And then Abubakar Kamara says, where are the deaths coming from? Government should also check the people that are requesting for passes. Thank you.
Okay, thank you very much.
Thank you very much. Colonel Bangura, should you wish to speak to any of the technical or operational issues, please feel free to do so.
Thank you. I think the last question is that whether government should do something more to check those applying for e-passes. Well, we transitioned from manual to e-pass system because we want to improve on not only the efficiency and transparency of issuing pass, but to ensure that we hold data in terms of all people that are requesting for pass, so that and those data could be used in the future for serious analytical purposes. So, but we started it just a couple of days ago, an hand-on-rail system. We are working with it. It proves to be working very well, and we are getting people to apply online. And for every reason, if you want to apply, you have to have mobile data, you have to have access to internet. So if you want to be like a prank, applicant, it goes with the cost. So, but when you apply, we'll still see the rationale. We have categories of people that I think are very essential towards the COVID-19 response. Health people, NGOs, government functionaries that must continue to carry out their day. We give this one priorities. And it's for that reason that we said all essential food items, that is food, beverages, fuel, construction materials, medical drugs and supplies, these ones have unhindered access, as long as they have a driver and 2 apprentices on board, not passengers. So that is the choke point along the main supply route from Freetown to the district. So that is working. And we realized that most people applied, over 50% applied for individual passes. Well, because we have in the inter-district lockdown and there are no commercial vehicle flying, we do not expect people to individually travel across these districts. But I said, as a test system, most people decided to test the system, whether it's working, and those applications came in bulk, especially individual, but we used the criteria that we set, and then just look at them, we said, okay, people are applying for individual. But once you apply for individual, you won't get the pass, because we don't want people to move across district. We want essential goods and services to permit the borders of the district. And I think so far it's working. People are not coming here, they are sitting in their homes or offices, apply, and they get their approval and they go about a normal business. So I'm sure we are working on it to make sure that we minimize or improve the system to create or to verify or vet those people that are making prank applicants, so that at least we'll be able to minimize the any platform for misuse. I don't know if that answers your question very well.
Thank you, Colonel. So I think somebody asked about Western area figures showing community transmission. The experts are looking at the figures very well, and I think that is the critical question that we continue to ask. What are the figures indicating? What are they suggesting? Do we have community transmission at this point? I would always say that there may be triggers, community transmission triggers. I say so very advisedly because the epidemiologists are looking at this very much, and we believe that about 96% of the cases that we have are epi-linked. So the remaining 4%, you don't want to be conclusive in making a determination that the 4% would account for community transmission, unless and until you are in a position to establish that indeed that is what they are pointing to. So the 4% even, you still have room for areas that may not have been established. So we are very much careful not to conclude that the remaining 4% could account for community transmission. But we believe, and I think it's important for planning purposes, that there are community transmission triggers. We believe unless there is contrary evidence. Having said that, with the figures coming up and having figures in unlikely places, I think it has justified the extension of the inter-district lockdown. I think Sierra Leoneans are having this consensus that it was necessary, that government thought very seriously about the inter-district lockdown, and that it was extended with the figures that are coming up. And I think it's important. Whether there would be a community-specific lockdown with particular reference to the Western area, our position is, and we'll want to advise the general public, that all options are on the table and that lockdowns are possibilities from now till the end of this scourge. It may happen at any time, as and when we think that the situation suggests this government will not hesitate to institute a lockdown. That is why we call it an emergency. That is why government is empowered to take those measures that are necessary and desirable to fight COVID-19. And as long as they are necessary and the experts have advised, and it is good that now His Excellency the President has constituted a scientific and technical advisory group to also look at these issues and advise. So be rest assured as Sierra Leoneans that whatever measures we have to take necessary to complement the fight and to protect our lives, we will continue to take those actions and measures. Thank you.
Thank you. Before we go up again for seeing some answers, I want to also stress that for community transmissions, if, like the spokesperson said, we have over 90%, very close to 94%, which are epi-linked. And most of these cases that you see in communities are linked to previous cases. And if we are not able at this time to ascertain the transmission chain, does not necessarily mean that it is community transmission. We are trying to get full evidence before we declare that we have community transmissions, because most of these cases that you see in communities, there are cases linked to communities, but they are also linked to previous cases. So it does not indicate that it's community transmission. Now we have some hand up. I can see Amadou Lamranaba. Amadou, can you just ask your question, please?
Yes, good morning once more. Thank you. I want to know the new death cases. Are they from the treatment center or other facilities, or at hospital like we had with the Connaughts, the Choitam cases? Are all of them from the treatment center?
Can you just answer that question?
Okay, let me straight away answer that question. Of these new deaths, we only have one that is in the is coming from the isolation facility. That is a 71-year-old person who also have some other challenges, health challenges. And the two, one is coming from Kenema and another is coming from the Princess Christian Maternity Hospital.
So one from the isolation center and the two are not.
Okay, Yema, can you just read some of these comments?
I'm also going to randomly go through the comments and questions. This is a comment from Suleiman Pascal Kamara saying, thanks EOC for timely posting of the update. Kudos to listening. Gezokelo has a direct question for you. He says, Mr. Spokesperson, you said that countries and institutions around the world are sending researchers and praising the system and how Ebola was conquered. So why can't the government use some of those officials who were in charge of the Ebola? This one is coming from Vicky Remo. She says, please explain the difference between sporadic, cluster, and community transmission so that people understand that these are WHO organizations' classification. That even though we may not meet the classification of community transmission, does not mean that people don't have coronavirus in their community.
Sporadic, cluster, and...
So the difference between sporadic, cluster, and community transmission.
Okay.
Okay, I'll let Harold take care of the second part. And for the first one, talking about what we did to fight Ebola and the fact that the Sierra Leonean story would seem to be an encouraging story, and whether we are cross-pollinating and utilizing the expertise involved in the fight against Ebola.
Please mute your mics. Please put your mics on mute.
So we are all aware that recently His Excellency the President also had discussions with Major retired Alfred Palo Conte, who was involved in the fight against Ebola. That was strong demonstration that this government has at all times intended to utilize the expertise and experience relating to the fight against Ebola. If you look at the wide expanse of the expertise now put at the disposal of the Emergency Operations Center, you have quite a good number of persons who are also involved in the fight against Ebola and whose expertise are being currently utilized by the Emergency Operations Center. So yes, there is no way we would want to forge ahead with the fight against COVID-19 without harnessing from that expertise. It's something that forms a critical part of what we do. Harold.
Yes. Okay, thank you very much. Before we go to the hands up, someone is asking about sporadic cluster transmission and community transmission. When we talk of sporadic transmission, these are occasional transmissions appearing in different areas at different points in time. And when we talk of clusters, it means transmissions within a cohort, like within a setting. And then when we talk of community transmissions, we are talking about transmissions which are secondary transmissions within a community that without any link to previous cases. So, and that one, you know, when it happens, then a lot of other investigations can be done, like looking at genetic sequencing or looking at the phylogenetic tree, so that we can link these ones to the origin of that transmission. And it takes a lot of time to actually ascertain that. So these are the three classifications. But as we are talking now, we are saying that most of the transmissions in Sierra Leone are epidemiologically linked. These are linked to previous cases from the imported cases that we had as far back as over a month ago. And there are certain cases that we are not able to ascertain the direct link as at now, but the surveillance team is working to ascertain the link to this transmission, whether it's linked to those transmissions or whether these ones are orphan transmissions. And okay, you have anything or else we go to the
hands up?
Yeah, there are hands up. Can you just
Edward Alicious.
Yes, Edward.
Yes, thank you, Aaron.
The next one is Alicious,
right? Can you get me?
Yes, loud and clear, please.
Okay, so my concern is there is this constant rumor of a 2 weeks lockdown, which is all over the place, and you see when you go out to marketplaces that there is panic buying, and the banks are almost always full. You see the queues outside. Those queues were not there before this rumor started going out about a 2 weeks lockdown. I know that will come directly from government, but the government spokesperson is also on this concern. Is it possible that probably you come out clean on this so that people get to understand whether or not there's going to be a 2 weeks lockdown in the coming week or maybe the week after? Because as you see, the crowds at the banks and the marketplaces, that's a huge concern in terms of cross infection.
All right, thank you. I'll respond to that immediately. As I stated in my response to the question relating to the Western area figures and whether those ones would be suggesting government's inclination towards instituting a lockdown, I will say at this point that all options are on the table. We cannot take the possibility of a lockdown off the table at this point. That notwithstanding, Sierra Leoneans have to understand that there is no need for panic. There is no need for panic buying. And as a government, we will continue to provide such assurance to our people. But there are all options on the table at this point.
Okay, thank you very much. Grace, can you make your point, please? Grace? I see your hand. Lamrana. Okay, yes, Lamrana, come on, please.
I just want to ask again about Connaught Hospital and not being a treatment center. For days, I understand case 90, who is the inmate, was kept there. And he's still there. And doctors have been complaining. Why? I still don't understand. We understand Connaught Hospital is not a treatment. They don't have a treatment center. They have isolation units. Why keep a positive case at Connaught Hospital and not sent to the treatment center? Is it that we don't have enough spaces at the treatment facilities to keep people at isolation units?
Okay, yes, we'll address your question. Yema, can you give us the...
I have a couple of comments and questions. So first of all, it's also a commendation from Patrick Levy. Thank you so very much, EOC spokesperson. I'm satisfied with your response. Michael Jones says, are there any provisions to get these daily updates in our main local languages? From Abdul Rahman Ba, he's recommending that we need to have the updates in Creole. Amanu Masali says, I cannot believe you have not been able to present your national team to date. What are we hiding? This makes your efforts not trustworthy. Why is the mayor of Freetown an award-winning Ebola strategist not on the team? From Ibrahim Jokman Fofana, it says, with all that truck drivers are transporting people to other districts, more especially Bo City, why do we have police and military officers along the Freetown Bo Highway? From Michael Jones, he's asking, can the EOC tell us what was the epi-link to case number 2? From Patrick Levy, are AYV and SNBC not doing a live broadcast of the updates? I think it is vital that they do. And then from Prezo Kelly, say thanks to all of you. Constant local community sensitization and awareness raising is very much important because most of our people lack the education and handling of COVID. And also shops and marketplaces should put in place the necessary precautionary measures. Thank you.
Thank you very much.
I would just wish to... somebody mentioned, I think, the mayor and some other...
Yeah, why are they not in the team?
Why are they not in the team?
And the national team, to present the national team.
Okay. Well, I think this one is linked to the previous response I had provided, whether persons who were involved in the fight against Ebola are also involved in the fight against COVID-19. And I had said first, within the layer of the experts at the EOC, you still have quite a good number of people who were involved in the fight against Ebola, and they are still here with us involved in the fight against COVID-19. Specifically with respect to the mayor of the municipality was here like 3 days ago, and I sat in a meeting with her. Before that, about a week or so ago, I also was watching television, and I saw her together with the Minister for Local Government. They were assessing the status relating to market women, possible relocation. I think at respective stages, the mayor of the municipality continues to be an integral part in the fight against COVID-19. So whatever conjectures that she's not part of what is happening, that is totally unfounded and baseless. Her expertise is very complementary to what we do in fighting COVID-19. Harold.
Yes, thank you very much. With reference to Lamana's question, we at this point there's no one from the case management here who will not give a definitive answer to that of your question, but I would attempt to give you a general answer, to that. When as I said earlier, every health facility has a temporary isolation facility. So if there are suspected cases, these cases are put in that temporary isolation facility. And they are so designed that it would have no substantial problem to all the other patients or health workers at that facility. So temporarily, these patients are being put there and monitored depending on the severity of the case. We have pre-symptomatic cases wherein they do not show any signs and symptoms, and we have asymptomatic cases. In other settings across the world, there are cases that are positive, that are even asked to stay home, and they are monitoring these cases. So it would all depend on the severity based on the astute judgment of the physician or the clinician at that point in time. But the case management team would have been the best team to answer that question. But I will just make this point very clear at this point. Thank you very much.
Okay, lastly,
yeah.
During the month done, you see, end of the month, you see,
can you give your name and your media house, please?
End of the month, you see people cluster at the hotel and the commercial bank. So, what strategy do you use to ensure that these people don't cluster to receive their money on a monthly basis?
Okay.
Okay, so I have 2 more.
So you have 2 more.
Let's have 2
Can you just
we'll have
say the 2 more and then?
Yeah. So I'll just go through 2 more, and this is random. One from Vicky Remo again. It says, if someone calls 117 for help, what is the process? What can citizens expect? And then I think Hassan Shaw is asking, what's the flow of updates from the DUC to the central EOC?
Come again.
I think he wants to know the communication lines between the DUC and the central EOC.
Okay. EOC and DUC.
Yeah, and there are several recommendations for the press briefing to be in queue, because it's a national issue for everyone else to understand.
Thank you.
Yeah.
Yes, Colonel, you want to take that?
Yes. If
Okay.
I just go by your question, you said the movement across the checkpoints.
No, for the 2 banks, the
bank.
Okay. Okay, for the banks,
people clustering.
we are advising every institution, everyone, to for physical and social distancing. But since this is coming up, I think this is the second time, would also intensify our drives to those institutions so that they will be able to do like crowd control, so that they get distancing for their clients going in, at those institutions. And for 117, this is also one of the tools we use. We call indicator-based surveillance. There are certain calls that are coming in through 117 that are COVID-related, and the calls are passed on to the appropriate authorities. And then, when someone, we're advising that if you have symptoms of COVID, fever, if you also have cough, dry cough, or you are feeling unwell, call 117. And when you call 117, they will be able to link, that call to the appropriate treatment facilities, and then our surveillance officer will go to investigate the case, and eventually, if the cases, if it meets the case definition, then they will institute, their protocols for the surveillance protocols. So that is what it is for 117.
So as a supplement to that, it's the 117 would respond to calls on a wide range of emergencies. So it is actually the nature of the emergency that triggers the nature of the response that 117 could initiate. So once the call is placed with 117, 117 now transmits what the need is to the person or the unit that is responsible to actually do so. So it is the nature of the emergency that triggers the nature of the response. Okay. With that, we want to thank you very, very much, and we want to use the opportunity to say thank you to our healthcare workers, our psychosocial workers, those in the surveillance team, and everyone that is involved in the fight against COVID-19, as well as your humble self, wherever you are, contributing to the fight, providing support. We want to take this time just to appreciate you, to commend you, and to thank you very much. And with that, I say God richly bless you. Thank you.
Thank you. See you tomorrow.